The Ministry of Health announced that there is irrefutable evidence that the new variant of COVID-19 mutant known as Delta strain has arrived in Rwanda. As Rwanda continues to enter into agreements with vaccine companies to supply the country with doses, the ministry warns everyone to be extra vigilant to the consequences of the new COVID-19 variants are severe. Ethan Toshobia has this report.
Some residents of Kigali believe that while vaccination increases the body's immunity to withstand severe symptoms of COVID-19, they also believe that those vaccinated are much safer from the wrath of the pandemic.
It's good that I'm vaccinated from COVID-19 because if I ever get infected with COVID-19, I would have the confidence that I would not get severely hurt.
On the other hand, those who have not received a single dose of the COVID-19 vaccines also express concerns about the possibility of developing mild and severe symptoms as the number of COVID-19 infections continue to rise in the country. We would like to ask the Ministry of Health to increase the number of vaccines so that many people can get vaccinated and have a better life, and in so doing, life will return to normal. The Minister of Health, Dr. Daniel Ngamije, said that Rwanda is set to receive batches of COVID-19 vaccines in the coming days through the agreements that Rwanda has signed with vaccines manufacturing companies. Some of the doses have already arrived in the country, and vaccination campaigns will continue as more doses arrive.
So we are importing vaccines, and recently we signed a contract with Pfizer to acquire 3.5 million of doses of Pfizer vaccine, and we signed also a preliminary agreement with Johnson & Johnson to get this vaccine through African Union mechanism. Those from Pfizer, we expect to get them by end of this year in different installments. Vaccine from Johnson & Johnson, 2.1 million. A portion of it, we might receive it before the end of the year, and the rest we receive it next year.
As the number of COVID-19 infections continue to surge, Minister Ngamije points out that there is evidence that a new COVID-19 mutant known as Delta has arrived in Rwanda. On Wednesday, 16 people succumbed to COVID-19 related complications in Rwanda, the highest number of deaths since the first case was reported in the country in March 2020. Health Minister says the Delta variant could be the reason behind the increasing number of COVID-19 related deaths in the country.
I think one of the potential reasons is that in the region, even worldwide now, Indian variant or Delta variant is really affecting, is the predominant variant of COVID, and it has high infections, and it causes severe forms of infection with symptoms and which are severe, high probability of death. This is probably one of the reasons of having an increase of people who died with COVID. I think for the first time since the beginning of this pandemic, yesterday we reached 16 people who died. It's unfortunate, but this disease, I want to call again the population that we should know, should be aware that this is the third wave in Africa and in other continents, of course, but it's clear that it's different with the previous wave that we had.
Minister Ngamije urges the general public to continue adhering to the set health guidelines, as this would be the only way to control the surging number of new infections in the country.
So we should comply with the COVID-19 measures. They are so simple. It's just a matter of being discipline to agree and comply with these measures. Leaders, families, members, parents, different people in their responsibilities should play their role, because it seems like there are some people who are undermining this disease, which is not correct. When we consider number of cases in health facilities where we treat COVID, serious increase of cases from 1st or 4th June means we should really consider that this is a third wave. We should comply with these measures to avoid that our health system being overwhelmed.
According to the Minister of Health, the vaccination program is currently underway with more than 390,000 people already vaccinated in Rwanda. Rwanda's mass vaccination campaign will resume this Friday at various health centers in Kigali, and the campaign will be extended to other parts of the country in the coming days, where vulnerable target groups such as elderly people above 55 years old and those with underlying health conditions being first on the queue. Reporting for RTV News, Ethan Tashabia.